today we're joined for this last session by three incredible physicians. We have Dr. Reyes, Dr. Manolas, and Dr. Roshal on, and I'm going to give each of them an opportunity to first introduce themselves, and then we're going to get to the question and answer portion, and we're just going to try to get through as many as possible. And remember, at the end of this, you're going to get your emailed certificate for your attendance for the entire day. I know it's been a long day. So Dr. Reyes, can you introduce yourself? Tell us where you're calling in from, a little bit about yourself.
Hello, everyone. I'm Dan. I am a third-year emergency medicine resident, about to finish residency, mercifully. I'm actually calling in from Toronto right now, so you might hear some whistles in the background. I'm actually at a water polo tournament, so I'm very happy I could join with you guys today. And what else? Yeah, let me know if there's anything else you want me to say, and happy to be here. Happy to answer your question.
No, that's perfect. And Dr. Manolas, you're next.
Hey everyone, so excited to be here. Feels like just yesterday I was trying to find one of these to get some advice as a pre-med, and here I am. But I am calling in from New York. I'm currently a first-year endocrinology fellow here in New York. I finished my internal medicine residency, I guess almost a year ago now, and I'm officially a board-certified internal medicine doctor that's specializing in endocrinology. And we'll get into that more, I guess. Thanks for having me.
Absolutely. And Dr. Roshal?
Sure. Thanks for having me. My name is Josh. I'm a general surgery resident up in Boston, Massachusetts, but I'm calling in from Texas right now. That is where I'm doing my education fellowship. I'm interested in surgery education, and I'm happy to answer anyone's questions.
Absolutely. Josh, I'm going to start with you then. Question for you, and it's a question I'm going to ask all three of you first as we're looking at questions in the Q&A as well. But just to get started, what made you want to become a doctor in the first place? You could have, gone into any different sort of career, but you chose medicine and surgery specifically. What made you want to become a physician?
I think it's the unique combination of problem solving with the impact that you have on your fellow mankind. And so, especially in surgery, being able to see some of the most tangible results from procedures and seeing people go from coming into the emergency room being in some of the most pain in their lives and trusting you, another person that they might not have met before, to do an operation for them while they can't advocate for themselves when they're in the operating room, to them ultimately leaving the hospital the next day feeling so much better. And I think it's that pathway of taking a patient from pre-op to post-op that really got me interested in medicine and surgery.
Awesome. Yeah, great field. And Dr. Manolas, what about you? What kind of got you interested in medicine in the first place?
I kind of grew up in a house of science, but that didn't really influence me as much. I think the fact that I grew up in this family that was very loud and loved to share stories at the dinner table, and that's kind of how I learned to interact with people growing up. And then I kind of entered this world of pre-med and started to shadow, and I realized like that was the best part of medicine as well, like getting to learn all of these patient stories and where they come from and how to apply that to their care. And I honestly found, especially in my internal medicine residency, that patients just have the funniest stories. Like they're sometimes ridiculous, sometimes hilarious, and that's really like what keeps you going in medicine. And that is what kind of originally drew me to it. So that's kind of what brought me in.
Awesome. And Dr. Reyes, what about you? And I'm going to go by first name from now on, just because we all, we're all good here. Dr. Reyes, what got you interested in medicine in the first place?
Yeah, so for me, it was kind of a lifelong thing. I had really bad asthma as a kid, so I was always around pediatricians, and they always made me feel a lot better. So I wanted to do that for other people. I when I was in college, I studied biology with the intention of going directly to medical school. But as Dan and Josh, who we all went to medical school together, as they all know, I was a teacher for a long time before medical school. So it was kind of like a little detour that I took because I really enjoyed teaching. But then when I figured out I achieved everything I wanted to do in the classroom, I decided to move on, back to my original goal of medicine. So yeah, it was kind of like a lifelong thing for me. And then in terms of emergency medicine, it's kind of what Josh was hitting on. Like the reason why he loves surgery so much is kind of like making people better. I mean, we do that in the ER too. Not everybody is surgical. So whenever they are, we have our great surgical colleagues to help us, but we can do a lot of things too in the ER, and we do them, and we make people feel better. And oftentimes you take them at their most vulnerable points in life, and that feels really good too.
Yeah, and so you've all three of you have gone through the very challenging process of first even getting into medical school, then getting into residency and beyond. So, looking back, for somebody who's sitting here right now, on this webinar, who's interested in becoming somebody like you, somebody in your shoes in, X amount of years going forward, I'm going to ask you first, Melina, what kind of advice do you give to somebody who's, maybe not gone through the whole process yet, but really wants to get to where you are?
I talk about this all the time because I think there's so much discourse out there about medicine is terrible and, no one should go into it anymore. I think we need to be real with like what the challenges are, but at the same time, still have that passion for what we do. And I think that's the point of things like this. I think my biggest advice is to, and I'm sure you probably heard this throughout the day today, is try your best not to do things for the sake of ticking boxes. I think that's what made me stand out as an applicant, is I tried to find experiences that were authentic to me, that I was still passionate about. And those were ultimately things that I felt comfortable writing about and talking about in interviews. So if you're not like a huge research person, like you don't need to do a bunch of research if it's not authentic to you. You can find other ways to carve your own niche in your own lane. And that's what I did. And that's what I would advise you guys to do too.
Perfect. That's a great answer. And Josh, a question for you then, in terms of, your background and when you were applying to medical school and when you were interviewing, do you feel like there was something particular in your background that helped make you stand out? Or what were some of those experiences that you had that you feel like medical school admissions committee members thought, hey, this guy would become a fantastic doctor?
I think touching to Dr. Manolas' point is that medicine is a lot more than just science and mathematics skills. And same with, as you can see with Dr. Reyes' path to medicine. It's important to diversify your experiences and gain skills outside of just direct patient interactions, whether it be leadership or teaching or volunteering, something that allows you to build skills in other domains, but it'll ultimately help translate back to how you're going to work as a part of a large healthcare team to deliver care and also to connect with your patients. So if you're in college and you're trying to figure out what kind of activities to get involved in, whatever you decide to do, really take that to the fullest extent. If you're interested in joining a particular organization, join that organization and then try to work your way up to being a leader within that organization, because it shows your commitment and your diligence in working with a group of people in order to achieve a common goal. So it doesn't have to be research if you're not interested in research, but if you are, then really try to show your dedication within that field.
Excellent. Thanks so much for that answer. And then Dan, a question for you, a question we've actually gotten a lot throughout the day on different panels, and it's been about more of a non-traditional background. There's people who have had other careers before they decided to become a physician. There's people who have had many gap years. There's people who, are going back at a later stage in life to become a physician. They're not just going directly from college to medical school. What can you tell us a little bit more about your background with that as more of a non-traditional applicant, and what advice you would give to people who are in those shoes?
Well, first off, having another career before medicine is actually quite a valuable asset to your portfolio, because it really shows that you, first of all, are kind of multifaceted. Like your personality has multiple angles to it, and it also helps when you're attempting to, like what I do in the ER is I have to meet somebody oftentimes on their most vulnerable time for the very first time and try to help them with what they're going through. That's not a skill set that everybody has, because some people just, it's hard for them to put themselves in other people's shoes, and that's fine. But I think having multiple skill sets, multiple toolkits in your tool belt is definitely an asset. The second part of your question was, I'm sorry.
No, and sort of that came across as you were interviewing too, and it was something that you must have mentioned a lot on your application. Like, how was that perceived, the fact that you had a second career or a different background than the traditional student maybe? How was that perceived when you were applying?
Yeah, very positively. It really, your dedication to something in life will come through, and that's kind of what Dr. Roshal was already hitting on, which is, and same with Dr. Manolas. You pick your few things that you were really good at or that you really enjoy doing, and you do them, and you kind of grow in the ranks of whatever it is that you're doing, and you kind of get your life experience that way. But certainly it comes across as being like, oh, you're dedicated, and And the other thing I would just say to anyone who is a non-traditional applicant and who is kind of looking down the long hallway in front of them of medical school and then residency, yes, it's long, but you at each step, and we can all attest to this, but each step you kind of progress, you're like, okay, I did that. I can keep going. And finally, when you're near the end, like I am, or like the others will be soon, is you're like, wow, I can't believe I did this, but I'm finally here, and this is what I wanted to do.
Great answer. Thanks so much for sharing that. And we have a question in the chat, which I'm going to direct directly to Melina. And it's something about kind of the bureaucracy that's involved in medicine and sort of the hurdles that are almost in the way of being a really good physician and being directly with patients. Like, you want to spend your time directly with patients, but there are a lot of other things about it. So this question is specifically, how do you maintain passion for patient care and practicing medicine when you start to see how much of the job is documentation and sitting at a computer with paperwork and a lot of bureaucracy? So how do you maintain that passion for patient care?
I'm still figuring that one out. I think probably most of us are, especially in this day and age where, we have all these online applications that patients can message you directly on, which is wonderful for patient advocacy for their own selves, but hard on the physicians. I think setting boundaries is really important with your patients. Like I'm predominantly in an outpatient-based specialty, so I'm constantly seeing patients in the clinic and ordering labs, and part of my job is then having to get back to them a few days later and setting those boundaries of like, you can expect a message from me one time in 3 days with your lab results and not 3 times a week. That kind of thing really helps you set your boundaries between work and home. Trying to be efficient using dot phrases and smart phrases within the EMR, the electronic medical record. Those are things that can help you get out faster and not to have to take as much home with you. But I think it's a hard question actually to answer. I'm still figuring it out.
No, and that's a good point. It's kind of a work in progress for all of us for our whole career to just continue maintaining that passion. But thanks so much for answering that. And the next question I see is going to be for Dr. Roshal. Josh, you're a surgeon. You clearly, we all work long hours. You work long hours too. You're standing on your feet a lot of the time. How do you avoid burning out? How, are you sleeping? Like, I don't understand how, people are asking, how do you balance your job as a physician, as a resident, with the fact that there are other things in life that you want to do as well? So how do you go about maintaining that work-life balance?
I think it's important to consider that your work-life balance is likely going to differ depending on which specialty you choose. And so it's unrealistic to expect that if you're deciding to train in a surgical specialty, that you're going to be working 9 to 5s on Monday through Friday and coming home and enjoying your weekends. That's simply just not how surgical training is designed. Because in addition to going into the textbooks and reading and learning about how to manage our patients' diseases, you physically have to be there to take care of them and learn the technical skills that are necessary to get them to the other side of their illnesses. And so surgical residency in general takes a toll on someone in terms of how many hours you work. And you can see that in the data, no matter what surgical specialty you end up choosing. It ultimately depends on your priorities, and it becomes very important to learn time management skills and figure out what's important to you so that you can continue to be your best self, not only for yourself, but also for your patients. And so there are going to be some things that suffer during your training process. Depending on what things are most important to you, whether it's spending time with family or going to the gym every day, you can find a way to make it work, but it's unrealistic to expect that you'll be able to maintain an entire spectrum of your work-life balance while also in surgical training. Outside of that, when you finally get a job after your training, then it depends, again, on whatever you want to do. You can be in the operating room until 11 p.m. every night. Or you can have a completely outpatient practice and only see elective cases and not have to do any emergencies. But the training in general is difficult across the board.
Yeah, and that work-life balance is something that you really have to prioritize. During training, it's difficult because your schedule is set for you. You can't really adjust it too much. But then when you go out into practice on your own afterwards, when training is finished, although we're lifelong learners, when you're working as an attending, there's a way for you to create that way to optimally live your life. Dan, I have a question for you next too, because you work in an emergency medicine and you're seeing people, like you said, who are maybe at their lowest lows of their entire life. It's an emotional position to be in. There's probably a lot of stress related to that. How do you deal with the emotions that are associated with being a physician? Because you really are seeing sick people oftentimes. There's a lot of highs and lows. So, what's a way that you can work on dealing with that as a physician?
It's a great question. So, the at the moment where you no longer feel anything during a code, for example, or after you lose a patient, I think that's a bad sign. But I certainly also would say that, we, especially in the ER, we deal with it so much that some of it unfortunately becomes mechanistic. Um, every patient is special, no matter what their presentation is, no matter what their background is. And oftentimes when they're coming in coding, you don't know any of that, and you do your best to get them back. One thing I will say about the ER that I think is underappreciated, particularly as it pertains to codes, is you need to remember that the worst possible thing that could ever happen to your patient has already happened. And so now what you need to do is follow your skill set, follow your algorithms, and trying to get them back. Does that really become easier emotionally? Not necessarily. I think everybody deals with it in their own way. The way that I personally deal with it is you think about them for a little bit, you debrief with your team, and you talk about the highs and lows of what just happened with your team. Like, you've got a whole, you're the physician, you're the one running the code, but you have 10 other people in the room who have very important roles as well that you cannot do your job without. So you talk about it as a team, you debrief, you give people space as needed, and then you've got more people in the waiting room that you need to see. So I just remember that, this is a special job that I'm very fortunate to be able to do. And yes, I just lost this patient. It was tough, but I've got 10 more to see. So here we go.
Yeah, absolutely. And it's a difficult position to be in. It's something that we're constantly working through as well. So thanks for sharing that answer. The next one I'm going to ask is to Melina, and I don't see it in the chat directly, but it's a question that I think has come up in a lot of people's minds before. And it's about kind of the different stages, because every stage is difficult, right? Being a pre-med is very difficult. Studying for the MCAT, applying to medical school where you don't even know if you're going to be accepted, and then going through medical school pre-clinicals and clinicals, and then taking your USMLEs or COMLEX exams, and then applying to residency, and then going through residency and going through fellowship. There's a lot of stages. Was there one in particular, or what do you feel like is the most challenging part of the entire process? Was there one specific stage? Was it the match process? Was there one thing that you feel like is the most difficult of them all? And is there one that you feel like is the most rewarding of them all?
I've talked about this before. I think that never-ending sentence that you just mentioned of the steps it takes to get to where we are can sometimes be discouraging to pre-meds, but I felt that way too at certain points for sure. But I think it's also rewarding because you have more moments to celebrate. You celebrate being done with one clerkship, you celebrate being done with clerkship years, you celebrate matching, you celebrate finishing intern year. There's so many moments to celebrate, which is another way to think about it in a more positive light. But I think the hardest part for me personally was residency in general. I think it kind of broke me in certain ways, built me up in other ways. I think just from a mental health perspective, you're not sleeping very much, you're seeing a lot of death. And that's not something that you see as much in medical school, to be frank. You're not necessarily there during those hours. You're not there overnight. You're not doing those codes. And so that was something that I struggled with. I never really was equipped to ask about mental health resources during pre-med or med school. But then when I got into residency, I felt like I had to advocate for myself in that way. And I think that was for sure the hardest part of the entire experience.
Yeah, awesome. Thanks so much. The next question, Josh, is for you. And it has to do with surgery specifically, because oftentimes, so there's this differentiator between going into like a medical specialty or a surgical specialty. If someone's watching right now and they're interested in being a surgeon, right? If they're interested in doing what you do, what advice would you give for them about deciding on the field and about sort of what they should be thinking about between now and the stage that you're at for becoming a surgeon?
I think if you're coming at it and you're in an undergraduate, then you have a lot of time. And chances are you're going to change your mind a lot during the medical school process. I know that I came into medical school wanting to go into a different specialty. And then even during my third year, which is typically when people decide and apply into the specialties ultimately that they're going to be in, I changed. And you see, even in general surgery, for example, 20% of applicants ultimately leave after their first year of residency to go to another specialty, whether it be anesthesia or something else within medicine. So you have time. And if you're interested in surgery, then good for you, and do your homework and pursue that specialty, get connected with surgeons, do clinical experiences if you're interested in research projects, because that's a good way of getting connected with surgeons, then for sure do that. But if you ultimately ask yourself, am I willing to make the sacrifice to my time and training years to do this? And your answer is no, then that's okay. Even if you've spent years wanting to do that specialty, you can go into something else. Nobody's going to judge you for it. People have those types of conversations with themselves. So I would say if you're interested in surgery at this point in your careers, keep on pursuing it. Once you get into medical school, then you can start really pursuing those clinical experiences more and becoming more familiar with what it takes to become a surgeon. And then it's ultimately a personal decision with whether or not you want to continue with it. And there's no pressure one way or the other.
Absolutely. Absolutely. Definitely. Yeah. And, there is time to change and decide. And that process, that's an evolving process until you go to residency. And even after residency, some people, like you said, change their career decisions. And the next question I have then is for Dan. If you could go back and do this whole process over, is there anything that you feel like you would have done differently? Anything that you would have changed about your application or your time in medical school or your time in residency? Was there a mistake that you made, or was there something that you feel like you would have wanted to go back and redo? Or do you like kind of how you did everything?
Yeah, I think first of all, just rounding out the last question, one of the people that graduated 3 years ahead of me in residency, he's now one of my attendings. He was a psychiatrist for 20 years before going back to do EM residency. So just to accentuate the point that you can choose your specialty, and if it's not for you, you can change it anytime. You can even do your specialty for 20 years and then decide that something that is different appeals to you more. But to answer your question, I would say in general, no. However, I would say the one big thing that I would have done differently is taken earlier advantage of all of the various support structures that exist for academic performance. As Josh can attest to, because we were roommates for a little bit, I am not a very good test taker, and I get a lot of anxiety related to tests. So at our medical school, we had a fabulous I honestly can't remember the name of it right now, of course, but it was basically like a way to receive counseling from people who were trained educational psychologists about how to go through the process of taking exams. And that was very, very helpful, but I kind of went into it a little late. I wish I had gone into it a little earlier and, used that to my advantage for the very important step exams. Of course, it didn't really hinder my career prospects all that much at all, to be honest. And I kind of knew that I always wanted to do emergency medicine when I entered medical school, and emergency medicine it's not an uncompetitive specialty, but it's certainly not one of the more competitive ones. So it's not like I needed to do fabulously well, because I knew what I could do and I knew what I couldn't do so in terms of exams. And so I was very honest with myself. But that being said, I still think that I could have done more with exam prep, and I wish I had taken advantage of all of the support structures that were certainly in my med school. And I hope for all of you who are here who will eventually end up in medical school, I hope will be at your med school too.
Great answer. And we're just going to keep moving through questions just so we try to get through as many as possible. I really appreciate you all writing in the Q&A and answering questions as we go. And again, whatever we don't get to, we're going to try to get through afterwards and send you via email. A physician will review your questions, so that we will have. But while we're on today, Melina, question for you about sort of something that the deans that we had on a panel earlier in the day really emphasized too, is that they look at applicants holistically, but there are still minimum criteria where it's important to still show that you can be academically successful with an MCAT score and a GPA. And for somebody who's applying who, say maybe finishing up high school or early college right now and interested in becoming a physician and going to medical school in a few years, what advice do you have for somebody to make sure, their GPA is as good as it can be, and that their MCAT is kind of at a threshold where medical schools will take a look and look beyond anything like that too? What GPA and MCAT advice would you say you have?
Well, to this day, I still think that the MCAT was the hardest test I've ever taken. I think that the step exams were really hard, but I felt like the more I studied, I could see some of that reward come back in my scores. With the MCAT, I felt like I could study like an extra 12 days and I didn't get a single point out of it. So I will attest to the fact that that was really hard. That was a really hard test. So it's not easy, but I think that if your GPA is not where you want it to be coming out of college, there are some programs that you can do if you're willing to take an extra year, like post-bacs or certain masters of science, for example, that are associated with medical schools that can boost your science GPA especially. So for example, I went to Tulane for med school and they have a master of anatomy, a science of anatomy there, where you do a whole year course in master in anatomy, and then you actually are the anatomy TA for the medical students. And because of that experience, they definitely had a leg up even in the Tulane medical school application process, because all the professors knew them, they knew the current med students. And so experiences like that are kind of like a double whammy, where you can get a better GPA and also expose yourself to medical schools and get your name out there. So I think that's one way to look at it. And then even things like Med School Coach, and there are some online free resources that people do even on social media. Those are things to take advantage of in order to get some better test taking skills.
No, that makes sense. That's really helpful. And the importance of the MCAT and GPA really can't be understated, because right, like schools, like we heard, really just want to make sure that you're going to be able to pass the test. In medical school, like we've been hearing all day, it's rigorous. So you don't need to have obviously a 4.0 and like a 5.28 on the MCAT, but it's still important to have those that show that ability to do well in school. The fact that you work hard, the fact that you can pass exams is just important. And then everything else beyond that is what we're also talking about. So Josh, I have a question for you as well. And it's also about the sort of leadership experience that it takes at every step of the game, right? Whether you're pre-med or you're in medical school, you want to show that you have those qualities and characteristics that will make you a good leader, because ultimately the physician is the leader of the healthcare team. So what are some ways that you think that pre-meds can show how they have those qualities and characteristics of being a good leader within medicine?
That's a great question. And like we're answering in the Q&A here, is leadership has come up a number of times. And like you mentioned, the physician is often one of the leaders or the leader in the healthcare environment when you're in the operating room. So you need to know how to lead a crowd and get people to want to unite under a common goal. And when you're considering where to find leadership experiences, they're often all around either your local community or within your college or university. So there are dedicated leadership type organizations that really try to foster leadership skills and public speaking, for example. There's something called Toastmasters, where you can really get a lot of practice public speaking. And then if you're interested in one of your own clubs where you have a group of people, it doesn't have to be anything large. If you're the president of your chess club or video game club, that's still leadership experience. You become more familiar with the different facets of what it takes to run a healthy and successful organization. And then if you're really into it, in the idea of putting forth policy changes, then you can get involved with your local student government or community type governments. Some people look to Greek life as an opportunity for leadership experiences. And so those organizations are all there. It just depends on how much you're willing to put in the work to go from not just supporting yourself, but to supporting a whole group of people.
That's a great answer too. And it really doesn't even have to be a formal leadership position. It's just the ability to show that, hey, I'm able to guide a group of people under that common goal, like you were mentioning. It's so important to show. Dan, the next question is actually going to be for you. And it's about like a nitty gritty thing, but it's about personal statements. And obviously personal statements are an important part of the game. And, that's the one way where you can kind of share your personality to an admissions panel and to a medical school. So when someone's thinking about writing their personal statement, they have nothing yet. They haven't even started writing. What would you recommend somebody start doing, or how would you recommend somebody go about preparing a personal statement for their application?
That's a great question too. So, I think if you distill down what a personal statement actually is, right? It's a summary of who you are, what you bring, what your brand is, what your motivations are. And so if you think really hard, if you have answers to all of those prompts, then writing your personal statement really shouldn't be all that difficult. Because if you're applying to medical school, you've most likely thought about all of those things already, and you've thought about the things that you've done in your life to bring those characteristics out. And so it really shouldn't be hard to write your personal statement. Of course it is, because it's a very it feels like a do or die thing, which of course it's not, but it feels that way. But if you can really, nail down, not so much an elevator pitch, because it's certainly longer than an elevator ride, but if you can nail down what it is that you're doing, why you're here, what you think you bring to the table, why they should choose you, then your personal statement should just kind of flow freely, because really what it is a summary of all the things that you've done. Some people choose to do things in a different way, and I mean, there's pluses and minuses to that, but I think if you just if it's putting your best foot forward, it's what are you bringing to the table, and how can you distill that to the admissions committee in the best possible way.
Yeah,
Right.
really try to understand your mission of like, who are you, what encapsulates you, and how can you best teach someone everything about you in a single page.
Absolutely. Melina, I know you've been typing an answer, so I don't want to interrupt you, but I have a question about, I know you might have wanted to mention something, so go ahead, but also then afterwards, I want to ask you about interviewing, because the interview is such an important part too, because once you get an interview to medical school, it doesn't mean you're accepted to that medical school. Do you have any experience interviewing people? And also, what interview advice would you give to students who are kind of considering getting to that next level? And then when they're doing it, what advice would you give?
Yeah, I guess what I was going to jump in to say is relevant for both the personal statement and for the interview itself. So I think one of the things that I struggled the most with when I was applying is, how do I talk about myself? I've never really had to talk about myself so much, to use descriptors about myself and come up with all of these things. I would ask my family, I would ask my friends, like, how would you describe me, to try to get ideas. But really, what actually one of my pre-med mentors and advisors told me to do, which I did, was take a personality test online. I think personally that it's a really good way, like a Clifton Strengths or like a Gallup Strengths test. And they kind of spit out like 10 strengths and descriptors of you. And you realize, like, oh my gosh, those are quite accurate. And obviously you're not going to use those word for word, but then you start to get ideas from that. And that's something that I use commonly during my personal statement, when I was just trying to fill in experience and what strength I had from that, or during an interview. So I really recommend that all pre-meds and even residency applicants do some sort of personality test to get another perspective on how to speak about themselves well.
Yeah, thank you so much for sharing that. Having a personality test is probably really helpful, so that you really get to know yourself and how you're going to answer these questions and truly what drives you. Dan, a question for you that's sort of on the same topic of people applying. Was your interview experience overall, was it all standard? Was it just traditional one-on-one interviews with people? Were there multiple mini interviews? Are there different kinds of interviews in general, and how would you recommend students approach the interview if maybe it's not even just a one-on-one conversation?
So fun fact about me, and just to give all of you here some perspective, I think I'm surrounded by nothing but glory, I can tell here in this group. And I almost feel like I'm not worthy, but I applied to many medical schools and I got 2 interviews. I only did one, and it was Robert Wood, which is where we all went. Me, Dan, and Josh went to school, and it was multiple mini interviews. So that was my only experience. The second interview I wound up not accepting because I had already gotten in to where I wanted to go. So so I only experienced the MMI, and I loved the MMI. So, and there are some feelings about the MMI. I'll be honest. Some people love it, some people don't. I love it because I like talking to lots of people. It's like, that's my style. It's part of the reason why I went into emergency medicine, because it's a lot of talking, it's a lot of schmoozing, and that's essentially what the MMI is. Residency was also that. So I don't really have any experience with one-on-one, like winner take all type thing. So I'm probably not the best person for that, but for my previous career in teaching, a lot of the interviews were like that. And, it's kind of, you kind of hope for the best because you only have one. And, ultimately one of the sort of skill sets that they want to see in someone who's wanting to be a physician is your ability to talk to pretty much anybody. So not everybody has good experiences with that. Sometimes people, the interviewer says something or you say something and it just doesn't go very well. But, ultimately, one of the things that they want to be able to see is you're able to talk to anybody, be put into any situation and get yourself through it. And so, and honestly, the way to do that is to just be your authentic self. It's not that any of you would, but faking it is easy to see. So if you have sort of a manufactured answer or one that you've rehearsed a bunch of times, that's going to be very obvious to any interviewer. Whereas if you're kind of just your usual self, being who answering truthfully to you, I think that that's going to be your best bet.
Yeah, definitely. And, communication is one of those critical physician skills, right? Because that's what we do all day, right? We talk to patients. So being able to talk to anybody from any background in any situation is really important. And so I have sort of a tangential question for Josh around the topic of communicating, because medicine, it's a fairly small field, and networking is such an important part of that. So when you're applying to medical school, or even beyond that, when you're applying to your residency programs, it's a lot of it really does become how well you're able to network, whether it's at conferences or just in general from your mentors. Josh, what are some tips that you have for people who, are looking to expand their network and kind of become better communicators with different people who can help them in the future?
I think part of it is just putting yourself out there and putting your foot in the door. And that can be a little bit overwhelming to do sometimes, especially if you don't know someone or if there's a specific social hierarchy that makes you feel uncomfortable to do so. And so one way that kind of levels the playing field a little bit, if you don't have the time or money to be able to attend special conferences, for example, where research is disseminated, that's a great place for one, and for you to meet potential residents and attendings that you can interact with in order to get a better idea of what the field is. But it can be expensive to go to those types of events. One way that kind of levels the playing field a little bit is social media. And so you can start to build a professional profile and network for yourself as well as a brand that costs little or to no money. And depending on how you approach connecting with people online, you might be able to make some connections that ultimately can give you a better idea of what the field looks like, and allow you to learn from others. And I think that definitely becomes helpful when you're trying to apply for residency and you're trying to learn about different programs when you don't necessarily have all the information spoon-fed to you at once. So going to events, putting yourself out there in the form of social media, whether it be Twitter or LinkedIn or things like that. And then go to things that your local school sponsors. So if it's suturing workshops or teaching events, research symposiums, things that don't cost any money, you can go there and just try to get an idea of the types of people that show up, and you can interact with them. If you're a leader within an organization within your institution, you're in more of a position to invite people to come speak at your organization. And so that's one way to build those connections. It's all about kind of being a little bit creative while also understanding the boundaries that happen with certain social interactions, depending on which venue you use. But there are various opportunities.
Yeah, that's fantastic point. Really, like even using social media is so valuable. And I know we're going to share any sort of ways to get in touch with you guys if you're interested at the end of this as well, because I know there's a lot of valuable advice out there online. So even just being here and listening directly to our panelists is just so helpful already. But my next question is going to be for Melina, and we're seeing a lot of excellent questions coming in through the Q&A. Many of them are actually by high school students. So people who may be juniors or seniors in high school, and that's early on in the game, but at the same time, what advice, Melina, would you have to somebody who knows already at the end of high school that, hey, I want to be a doctor. What should I be doing right now to put myself in the best position possible to do well and to become a physician?
Well, first of all, that's amazing. I think a lot of us, at least myself, I was still lost in high school as what I even wanted to do, like the next weekend, let alone as a career, even if it was an interest. So congratulations. I think that something that you can do early on is to talk to as many physicians as possible. I think part of the reason that there's a lot of negative discourse about going into medicine is because I think some people don't experience enough or shadow enough before they apply to medical school to know exactly what they're kind of getting themselves into. And I think at that stage, even in high school, it's really nice to get to be able to shadow if you can, even as a volunteer, to see if this is something that you actually want to pursue through college. So that's one thing. The other thing is to kind of along the lines of what we've already been saying is to find a niche. So for example, in high school, I really liked Spanish. I loved like Spanish language. It really has nothing to do with medicine, but my Spanish teacher was like, oh, I have an opportunity over the summer where you can come and teach ESL to some of my students at the church. And I was like, okay. And that kind of kickstarted the entire experience that actually got me interested in medicine, public health, immigrant health. And I stayed on with that experience all through pre-med and college as well. And it was the basis of my essays and the basis of my interviews as well. So I would say dip your toes into as many different experiences as you can, because you'll be surprised at which one ends up bringing you the kind of standout experience that you're going to talk about in your med school applications.
Right. And you never know which one of those experiences is going to be the one that you really, really find enjoyable and just pursue in depth, because it's not just
Exactly.
it's really about the in-depth quality of those experiences and being able to talk about them, right? And so, Dan, question for you. You mentioned your application to medical school, and it's important to kind of tailor your school list too. So if someone's planning to apply in a few years and doesn't really, there's hundreds of medical schools total, and they might not know which ones to apply to. What advice would you give about creating a school list and then deciding on who to actually send the application to?
There are many resources that one can use to get a list and then to kind of pare it down appropriately. I would say the best place to start would be your undergrad advisory office. Obviously, if you were removed from undergrad like I was, this is not as good of an option. It's not that it's not an option, but maybe they're not as familiar with you anymore. However, there are also other things, other research you can look at to kind of like what are the minimum, usually the minimum MCAT scores or whatever. I know a lot of schools try to say they don't do those things, but ultimately at the end of the day, a lot of them do. Honestly, a lot of this process in medicine is about being honest with yourself and about what your skill set is and about what your capabilities are. And so I think at the end of the day, that's really the best strategy. And there's so many opportunities to judge people in medicine, and we try our best not to. But this is one of those cases where it's like, nobody's judging you here. Pair your list with sort of what you can accomplish, and then also like where you want to be. Maybe you don't want to be in a place that's really hot, so maybe avoid the Southwest, or you don't want to be where it's really cold, so you should avoid the Midwest or the East Coast. Stuff like that, because you're going to be there for 4 years, and it's hard, really hard. So you might as well enjoy yourself where you are.
Southwest kind of nice though. I'm just going to say that.
Yeah, coming from someone who grew up on the East Coast, I'm not confused at all as to why you said that.
Yeah, it's such a good point, because you're physically going to have to be there for medical school, and then you're physically going to have to be where you match for residency. So that's a really interesting point about applying where you actually want to be located. And the next question is going to be to Josh about questions that we've gotten about study strategies and overall how to do well. We've talked about the importance of having a high GPA and a high MCAT, and then obviously during medical school you want to do well, and during you're studying for the board exams, you want to do well on your board exams. How would you approach that question? It's just studying how to do well in a school educational environment, get a high GPA, do well on your standardized exams.
I think that's a very loaded question. And what I'll say is that it's a combination of two things. One, there's plenty of research to support some evidence-based study strategies. So if you like, for example, flashcards as one way of spaced repetition to constantly see the same things over and over again to build your memory and knowledge, that's one way. But aside from evidence-based, there's also personalized study strategies. So some people just don't like flashcards, so that thing doesn't work for them. And so there's two ways of going about figuring out what strategies work for you. One is through trial and error, and you figure out what things work for you depending on the class and the type of material you're trying to learn. And then another thing that Dr. Reyes pointed to is that if you have access personally or as a part of your organization to an education psychologist or an education researcher who can sit down with you and kind of take a look at the data, meaning your specific performance in certain classes and materials, and try to figure out what works best for you given your study schedule, how you like to study, how much time you can dedicate to studying, and then can kind of point you to resources or different things that have worked for students in the past who have similar types of patterns of behavior. And I think that allows you to take some of the things that's known in science to say what works and what doesn't, while also making them a little bit more personalized in terms of what you're able to put forth in the process. So I hope that's helpful.
No, that's really helpful because, there are definitely ways to do well, and, it's different things work for different people, but having that ability to really like dig deep and figure out how you study well, which could be different at different stages of the game too. That's really helpful. And we've mentioned it before, but even working with a tutor can be really helpful if that's something that you need for a specific exam or in general. There are a lot of resources out there, and doing well, it takes a lot of hard work, but there are ways that you can really boost your chances. So that's a great answer. And the next is going to be about something that we got asked, I think, really early on. It's going to be from Melina, and it's going to be about a day-to-day. Every day-to-day is different, right? All four of us have a different day-to-day. But, what is it like being, in your shoes for a day? Melina, what is it like from the time you wake up to go to work, to get things done? What is it like being a physician?
So my life is definitely much better now that I finished residency, that is for sure. So currently as an endocrinology fellow, I guess my job is to develop an expertise in a specific specialty of endocrinology. So it's a lot more, trying to figure out how to study on my own time and to create an interest within that specialty, but the hours are much better. So I typically don't have to be in the hospital till 8 a.m. I have like didactics from 8 to 9, and then I see patients all morning, and then I do consults all afternoon in the hospital. So any patients that are admitted that need an endocrinology consult, I will be that person that's called, and I will staff that with my attending. Usually I'm home by 6 o'clock. The hard thing though is that, when you're doing an outpatient-based specialty, as I alluded to earlier, there's some work that you have to do from home just because you have to finish notes, you have to prepare for the next day, you have to get back to patients and call them. And so I do often do 1 to 2 to 3 hours of work after work, but not commonly. So my job generally is much more like a 9 to 5 now, which is specifically why I chose this specialty. Not saying that as a woman you have to choose a specialty like this, but for me personally, for my mental health and for the fact that I want to prioritize my family in the future, it was something that I did intentionally. So I'm very happy now with my schedule.
Awesome. I see Dan over there saying hours of work after work. Like in emergency medicine, it seems more like shift work, right, Dan?
Absolutely. I don't even know what it's like to be working from home. I mean, and there are benefits to that too. I mean, some people like working from home, but when I'm at home, I am not working. I'm watching TV, I'm eating, I'm going to the gym, I'm swimming, I'm doing whatever I want to do. And I know when my next shift is scheduled, then I go to work and I do it. But that's what one thing that's really nice about emergency medicine is that it is shift work. It's very defined hours. There's no call. That being said, part of being an emergency doctor is you have to take care of critically ill patients. And the way that we do that is by doing ICU rotations. So ICU is, of course, an inpatient rotation. And depending on which ICU you're working in, you can work 12, sometimes 24, sometimes 28 hours. And so then it's a really, really long day and it's not great, but that's only for a month at a time. So, and you can do anything you want for a month. So yeah, but one thing that's great about emergency medicine is that it's shift work. And a lot of times there's opportunities to kind of pad your pockets a little bit. So if you want to make a little bit more money than maybe some of your peers at your job, you can elect to do all night shifts. Like I love night shifts. I love the night crew. I love the vibe at night. And so if I won't be doing this, but in my job, if I were to say, hey, I want to work all night shifts, most likely I get a little bump in pay, which is nice. But all these things are characteristic of shift work. And once you get home, no work. You just sit and do whatever you want.
Gotcha. That's awesome. And a question for you, Josh, about surgery specifically that I was seeing earlier too is that, the medicine and surgery in general are constantly changing. The way that things were done maybe decades ago isn't the way that things are going to be done in the future. And is there any sort of trajectory that you see the surgical field going forward? So somebody who's sitting here right now who's a pre-med and wants to become a surgeon, how do you think that being a surgeon is going to look different in maybe 10 or 20 years than it does now, or maybe even the process of becoming one?
Great question. Surgery is slow to change, but has undergone significant changes over the past 50 years. For example, we used to do all procedures with big incisions and now we've really started to do a lot more what's called minimally invasive surgery, where we can do similar types of procedures through smaller incisions to deliver smaller instruments. We still do large open surgeries, but there's a lot more emphasis on trying to use technology. So robotics has become a big part of a general surgeon's practice, and in some subspecialties as well. And surgical culture and the training itself has changed. It used to be that 20 years ago, it was a resident doing a case by themselves in the operating room with an attending surgeon nowhere in sight. And now there's a lot more structure and feedback in order to try to make sure that the surgeons that we're graduating know how to do procedures and are safe to do them independently. And surgery is going to continue to change as we begin to experiment and integrate things like artificial intelligence in our preoperative, intraoperative, and postoperative care. Things will hopefully become a lot more streamlined and allow us to spend more time doing the things that we like, which is operating and talking to our patients. And our culture is only going to get better as people who have now or are training in the current experience, which is a lot more open and transparent compared to how it was, will rise into positions of leadership and start to enact change through policy. So the future of surgery is great and will continue to get better as we start to integrate technology.
I love that. That's a great answer. And yeah, the future of medicine and surgery is going to look different than what it was now. And I remember when we were in medical school, we were told, some of the things that you're learning about now, they might not even be true in the future, right? Like we are constantly learning more about medicine. We're constantly learning more about the human body and different ways to treat diseases and overall about different diseases. So there's a lot of exciting things happening in the future, and medicine is just a great field to go into. So the next question then is for Melina. I know we have about 7 minutes left. So a quick question for you is, where do you see the future of medicine or your field in particular going over the next few decades?
The good thing about internal medicine is that if you have commitment issues, so to speak, like you don't have to commit yourself to something right away. You can still do something procedural, you can still do something non-procedural. And so the doors have always been open, I think, in that regard, with regards to an internal medicine specialty or residency and what you can do after. But I think with technology and with AI, I think it's going to get even more broad. I think that's not only for IM, I think that's for all medicine specialties. Maybe more opportunities to work from home, maybe more opportunities to do, again, like less invasive things. And so that's kind of where I see medicine heading. I think it's going to be a lot easier to communicate with our patients. And we're going to have a lot of different perspectives come in because of that. So I kind of see that as diversifying the internal medicine experience and being able to be even more broad, not to commit yourself to something soon.
Yeah, great. And so we have a few minutes left, and I want to make sure each one of you gets a chance to sort of say your final words to everybody who's watching, right? This is your chance to sort of give the biggest piece of advice you would have for somebody sitting right now watching on their Saturday evening, hearing from current physicians as people who want to become physicians. I'm going to give each one of you the chance to answer essentially, what's your biggest piece of advice? What's the takeaway that you want students here watching right now to really benefit from in like 1 or 2 minutes? And we're going to start with Dan.
All right. So I would say, remember what it is that you're going into this for. It's a very, very long journey, and it's very stressful and emotionally challenging. And you're going to get to many points where you're going to be like, why did I do this? What am I doing here? And you're going to have good friends, classmates who are going through this with you, who I hope that you'll be able to lean on, who can remind you. Family members can do the same thing. Significant others can do the same thing. But there's going to be those points where you're going to be like, wow, what am I here for? And then something great's going to happen. You're going to get a good exam score. You're going to nail an OSCE. You're going to see a patient and you're going to catch this crazy illness that is very uncommon. And you're going to feel so good about it. And you're going to be like, this is what it was for. So it's kind of a roller coaster. And like I said, it's very long. So just remember why did you come to this seminar today? Why did you decide to throw your name in the hat? Or whatever that was, or whoever it was for, just remember that when you're going through it, because you're going to need that motivation. Unfortunately, you're going to need it a few times. So, and then beyond that, just like I said earlier a few times, like be yourself. The most important aspect of, I think, patient care is the authenticity of the physician or any other provider that's providing the care, because really it's trying to meet somebody where they are. And oftentimes what can be their most vulnerable way. And if you're not even being true to yourself, you can't possibly provide that patient with the best care. So remember why you're doing it and be your authentic self, and that'll take you a lot of places.
Awesome, great answer. And feel free to drop your sort of Instagram or anything, any way for students to get in contact with you in the chat if you'd like, and share that as well, because I know a lot of people have a lot more questions than we were able to get through today. But thank you so much for being on the panel. Josh, I'm going to ask you the same thing. What's your biggest piece of advice to everybody who's watching right now?
Yeah, I think it's be honest with yourself and what you want to accomplish during your life. If medicine is something that piques your interest and keeps you going, and your daily interactions with patients are the things that make everything else worth it, then focus on that and keep going. For surgery, for example, a lot of people go into surgery because of like I mentioned, the tangible impact that you can have on your patients. And despite all of the bureaucracies and paperwork and stuff that we have to deal with, all of that we do in order to continue to be in the operating room. The operating room is our safe haven, for example. So if that's your thing, then continue to do it and don't let anybody stop you from doing it. Put your 100% in, take breaks when you need it, but continue to follow your passions vehemently. That being said, if through your experiences you realize this isn't for me, then take that and go somewhere else, because nobody's going to benefit from that type of exchange where you're not interested in it, and ultimately your patient feels like you're not putting your all into it, and you might be happier in a different field of medicine or outside of medicine completely. So be honest with yourself, and as long as you're passionate about something, that will continue to push you through more than any amount of money or anything like that. Pay attention to your intrinsic motivation for why you're there. So I have difficult times during surgery residency where I have to work long hours and I'm under a lot of stress. And then I have an interaction with a patient where I realize, wow, I'm actually helping this person navigate this really complicated system and can help them feel better and get to the other side of this. And that makes it all worth it. So continue to follow your intrinsic motivations.
Thanks so much. And I see you're writing in the chat for how people to get in contact with you as well. Thank you so much. And now for our third panelist, Melina, what advice would you give?
I think we kind of all have the same advice, which is I personally think that medicine is my favorite job. It's the best job. It's the only job I could really see myself doing. And I love it. I really do. Even at the end of the day, you come home and you still have to find those gratifying experiences that make you want to go in the next morning. And while it is the best job, in my opinion, and it's amazing, it's not worth losing yourself over and losing who you are, which is, I think, the most important thing. So as much as you love it and as passionate as you are about it, if it's something that you're losing yourself over, go back to the things that make you who you are, that you're passionate about. Maybe it'll lead you back to medicine, or maybe it won't, and that's okay too. But it's definitely not worth your mental health or your life or losing your interest outside of medicine. If you come back and you veer back to medicine, then you're gonna get a lot out of it. But that's the way I feel, and that's my take-home message. And the last thing I'll say is college is the last time you really have to take any class you want in like any breath that you want. And I wish I had taken more like really unique and cool classes that I wouldn't be able to take again. So don't worry so much about taking that extra like neuroscience or like physiology class to look good for your med school application. Take something cool that you can talk about and that you'll never be able to do again.
Amazing. Thank you so much to our three panelists. That was incredible. This is so informative. And I see people in the chat who are just reinvigorated into their passion for medicine and surgery. And I know that a lot of people are going to be contacting you individually. Thank you again so much for taking the time. You guys are free to log off, and I'm just going to do a quick recap for everybody who's the participants on the panel. But thank you so much to our panelists.